Today Health News, we're giving you more information about the medical condition Barbara Bush suffers from. First, she has congestive heart failure, but also COPD. Joining us to explain is Dr. Shelley Hall, Chief of Transplant Cardiology and Heart Failure at Baylor Scott White. Hello, Dr. Hall. First, tell us about COPD. What does it stand for, the symptoms?
Sure. COPD is chronic obstructive pulmonary disease, and it's a broad term used to describe a collection of conditions where the lungs don't function properly.
And a lot of older patients suffer from it. I mean, is it easy to diagnose? Do they know that they have it?
It's not as easy to diagnose as you would think. A lot of times people complain of shortness of breath, and typically an x-ray is done. Sometimes the lungs will look enlarged. If you have a smoking history, then most people will assume it's COPD. But the best test is pulmonary function test, which actually analyze the lungs' abilities to fill, to release air, and everything in between. And that's the proper test.
So with COPD, does that lead to congestive heart failure here as a result of the complications of that disease?
No, they are not related to each other, although they do both share the risk factor of smoking. Now, COPD can cause right-sided heart failure, but that is usually not what we mean when we say congestive heart failure, which implies that the heart doesn't function well either by being too stiff or being too weak to circulate blood.
Well, we do know that Mrs. Bush had smoked in the past, although she had quit. But just curious, what are the treatments for either of those?
Well, the treatments are completely different. Congestive heart failure uses a collection of various oral medications to try and first reverse it. In the first stages of a disease, we look for a cure. In the next phase, if there's not a cure, we look for treatments that improve the longevity, the quality of life, and the survival. And for congestive heart failure, it's this collection of pills. For COPD, it is various inhalers depending upon when the lungs respond. For all chronic conditions, once you no longer have treatments that can improve the quality of life or prolong survival, then you move into the final stage, which is controlling symptoms.
Would that be equivalent to making someone comfortable at that point?
Correct. Comfort measures are purely to focus on controlling symptoms as much as possible, as long as possible.
Thank you so much. Once again, that's Dr. Shelley Hall of Baylor Scott White.